Welcome to Your Family's Health. This is Joan Buckley from the Department of Nursing here at Nassau Community College. Your Family's Health is a program that focuses on healthcare issues and the resources available to you here in Nassau County. On the show, we speak to experts from around the country to keep you up to date on current healthcare issues and trends. Today, we're going to be speaking to Dr. Lincoln Hernandez about a topic that we all know, GERD. And Dr. Hernandez is very interesting. He's from the Dominican Republic originally. He's educated there and here in medicine, and he's presently actually faculty on the Mount Sinai institution right here in New York. So we're going to talk more about how to stay healthy in Nassau County. So stay tuned for the next half hour to the voice of Nassau Community College 90.3 WHPC. So welcome to the show, Dr. Hernandez. Now, Dr. Hernandez, we've planned this interview around a topic called GERD, and part of your certification, though, you're internal medicine, but you're also gastroenterology, so it covers a wide range of GI issues or gastrointestinal issues, correct? But how did a guy like you, a young doctor, how did you get involved in this? This does not seem to be one of the most glamorous I guess if you're in GI, it is glamorous, but you know what I'm saying? How'd you get into the GI field? Why not something that's more cardiac or neuro? What brought you to the GI world?
Well, first of all, thank you for having me on the show. I think this is a great honor to begin. As for your question, I think when people go into medicine, initially, the main thing is that it's more like a vocation. It's something that really inspires you. And that's how you get through medical school, to be honest with you, because this is a long road.
Yeah.
As you go on in this process, you tend to meet mentors and people that you have things in common with and that you admire. In my particular case, my mentors just happened to be gastroenterologists.
Wow.
These are the people that I admired and wanted to be like, and it led me into this pathway. In addition, gastroenterology is a fun part of medicine because it has two things. It has the internal medicine part, which you do the doctor, an internal medicine thing, but you also do procedures a lot. So there's a little bit of surgery involved. So it's a bit of a hybrid to some extent, and I like the combination of that.
I like the combination of it as well. When I became a nurse practitioner, I wanted a job so bad in this GI practice on the North Shore. So bad. I really was disappointed when I didn't get it. And it's part of almost everybody's daily life. I mean, everything else is kind of like out of the ordinary. But one of the first questions when you see your physician is they ask you about your GI system and are you having any problems? Because it's kind of like the window to a lot of other things. Now, when people think of your practice, exactly what is gastroenterology? You talked about being in internal medicine, being a component, but what is the gastroenterology piece in what parts of that?
Well, gastroenterology is a specialty from the internal medicine world that concentrates on the diseases that involve the gastrointestinal system and also liver, which includes basically your gut, stomach, pancreas, gallbladder, liver, all the fun stuff, to be honest with you. And the entire gastrointestinal tract extends from the mouth all the way down into your anus, and it is a very complex and intricate, functionally intricate system that we basically try to evaluate and treat the diseases that have the percent in the GI tract. And these diseases can vary from very benign diseases like just reflux, which in many cases is benign, is a benign condition, but it could also be things that are serious, like Crohn's disease or ulcerative colitis, which could lead to impaired quality of life and death. So,
it's a very extensive field that concentrates in the GI tract. Yeah, the GI tract is. It's not simple. It seems simple when you say from the mouth to the anus, but it is very it makes total sense when you think about it. It makes total sense. What you put in comes out, and what happens in the middle is affected by, like you said, all the different organs that are attached. There's no separating any organ anymore. But we wanted to talk today particularly about GERD, and you did mention GERD, and it's something that's in the advertisements that people see on TV. Everybody probably at some point in their life has experienced heartburn. But heartburn really has nothing to do with the heart. So can you kind of fit heartburn into the GI tract and tell people exactly what's going on when that happens?
Sure. So,
just stay close to your phone. I just want to remind you, perfect. Perfect.
Yeah. So, usually heartburn is a burning sensation in your chest area. It's basically an irritation of that's caused by contents of the stomach, mainly acid or sometimes food, that regurgitate or backflow into the esophagus. So basically, the esophagus is the tube that connects our mouth to our stomach. That long tube, this is what the food travels down to, and it goes into the stomach. Right before it enters the stomach, it reaches a part of the esophagus called the gastroesophageal sphincter. So this acts like a valve which opens up and lets the food go into the stomach and then closes again, so things will not come back. When people feel like they have heartburn, it could be from acid from the stomach that just happens to backflow going in a reflux type of direction from the stomach into the esophagus, causes irritation, and it causes the symptom of heartburn.
Now, people get told that they have reflux. Is there a difference between heartburn and reflux, or are they connected and it's just a different term? Like, I know people get told, I have, reflux. And it's not that clear. Like, so I thought I had heartburn. Now they're saying I have reflux.
Well, yeah, so heartburn is the typical symptom of GERD, right? But it's the terms are interchangeable, basically. I think they're one and the same. Reflux and GERD, you can pretty much say they're the same, but the symptom of heartburn derives from both of them. The actual feeling or symptom that people usually experience when the stomach acid comes up from the stomach into the esophagus, it's basically that feeling is the heartburn feeling. But the mechanism for why this happens is the actual condition of GERD. And then reflux is just another term of it. So it's basically semantics, and semantics sometimes lead to confusion, but they're all part of the same process. Okay. Sometimes people use the term acid reflux and heartburn interchangeably. It's also important to understand that sometimes it's not just acid that's coming back or reflux. Sometimes it's other things. Sometimes it's air. Sometimes it's stomach contents. Sometimes it's food.
So what are the common symptoms? I know when I get heartburn, and I haven't had it in a while because I really try to avoid it, and we'll talk about that in a minute, but my ears burn. It actually is so nasty that it actually goes up, and my right ear actually burns. Is that?
Yeah.
I mean, what other not typical signs can people expect and say, oh, is that heartburn or is that an earache? Because it's...
No, that's actually not uncommon, and that's pretty high up there. So the acid can travel all the way up to the mouth, to the back of the throat, and sometimes people feel it in their ears. So there's some connections between the ear and the back of our nose and our throat that have been there. But there are symptoms that are not typical besides just the heartburn and this feeling of classic burning sensation that goes up upward in my chest area. The uncommon symptoms may be trouble swallowing, throat clearing, sore throat, wheezing, asthma, exacerbations, chronic cough, like I believe President Obama was diagnosed with chronic reflux induced cough, and also chest pain. And one common symptom is what we call globus, which is basically the sensation of a knot in your neck, in the front of your neck there. People feel like they have something stuck there, and that's also a symptom of reflux. And another common symptom is water brush, which basically all of a sudden you start salivating for no apparent reason, and your mouth gets filled with saliva.
Wow.
Yeah.
Thank goodness I only had the ear thing.
and also some patients do have reflux, and they have no symptoms at all.
Wow.
That's something that's important to know.
So how would that be detected? I mean, if someone doesn't have GERD, when would you see it then? At a late stage? Possibly?
Well,
what would they be in your office?
That's a good question, because when you have severe reflux for a long, long time, your esophagus, the line of the esophagus starts to have changes. And those changes involve what we called the becoming of the process called Barretts Esophagus. And when people have Barretts Esophagus, which is the ultimate end result of long-standing reflux, usually the symptom of heartburn goes away. But the problem with that is that Barrett's esophagus could predispose you to having esophageal cancer in the future. But that's something that happens in not a lot of patients, but it's something that we have to watch out for. When somebody has Barrett's esophagus, they've probably had a lot of reflux, and they don't have any symptoms now. So when somebody has reflux or signs of heartburn, or that is very common, more than 2 times a week, you should definitely have that. You should probably go to your PCP or your doctor to have that checked.
Okay, now we're going to talk about what happens after you go to your PCP, but first we're going to take a short break, okay? So you're listening to Your Family's Health on the Voice of Nassau Community College. This is Joan Buckley. We'll continue talking with Dr. Hernandez about GERD and reflux and other things that affect us all after this short break.
Music is a bridge between the material and the spiritual. My name is Harvey Lauer, and I'm 82. As a blind person, you have to be aware that nobody can tell you what you can or can't do. You really have to try things. My folks got me a little radio in 1940, and that was the best Christmas present I ever got. When I was 11 years old is when I started to play music, play the piano, and then the accordion, and then the cello. My wife, who was also blind, was a good cook. When she died, that's when I started Meals on Wheels. America, let's do lunch.
It's Meals on Wheels. 1 in 6 seniors faces the threat of hunger, and millions more live in isolation. Drop off a hot meal and say a quick hello. Volunteer for Meals on Wheels by donating your lunch break at americaletsdolunch.org. This message brought to you by Meals on Wheels America and the Ad Council.
WHPC.
Welcome back to Your Family's Health. This is Joan Buckley, and we welcome back our guest, Dr. Hernandez, who is from Mount Sinai's Institute. But what we were talking about before the break is very interesting, because you said that if you have symptoms more than twice a week, you need to contact your primary care provider, PCP, and he may or she may, they may, recommend a consult, correct? And that's where you would either see your patients on a different level, or you see patients that are new to you as the gastroenterologist. What might a patient recommend? What would be the procedure? Say they go to their primary, they say, you really need a GI consult. They come to you, they say, I've been having heartburn more than twice a week. What would be on their timeline then, from starting to see you till completing all treatments? Like, what would be the first thing you would start with them reviewing, or what? What should they expect if they were to go into your office for a consult?
Sure. So when the patient initially starts to have symptoms of reflux, they usually go to their primary care doctor, and most of the time it's managed well there. The patients that don't get better are the ones that are referred to us, or patients in which the primary care physician feels like that they may be something else that they want to check for. They're usually referred to us. So what we look for when somebody goes into a gastroenterologist's office with symptoms of heartburn and reflux that did not get better are what we call alarm symptoms. Symptoms that can tell us that flag basically an importance in this particular patient. So the age is one thing. So younger patients they don't necessarily need to have any particularly specialized testing for this. We basically can try to manage them, and they do well.